Nigeria's healthcare system is facing a severe crisis with a significant shortage of doctors and other healthcare professionals. The country has only about 40,000 doctors, far below the estimated 300,000 needed to serve its population of over 220 million. This translates to a doctor-to-patient ratio below the World Health Organization's recommendation. Arise correspondent Olije Wapera breaks down the factors bedeviling Nigeria's healthcare sector.
Over 16,000 doctors are estimated to have left the country in the last 5 to 7 years, with thousands more exiting in the last few years alone.
Nigeria's healthcare sector is currently facing a very dire situation. This is due to the brain drain the sector is currently facing. Healthcare workers are migrating from Nigeria to greener pastures to seek opportunities. This situation, if not checked, could lead to a very critical situation. In fact, an emergency of healthcare workers in Nigeria. We take a look at some of the critical situation facing Nigeria's healthcare sector, which is exacerbated by poor infrastructure, lack of funding, and of course, some of the basic needs of these nurses and doctors.
My sister, I went to a hospital in the night where I met a midwife conducting delivery using her handset to light. There are states where you see a fresh nurse receiving only 100,000, and so in some places it's even less than that.
Arise News speaks with nurses, laboratory scientists, and doctors in the healthcare sector.
In Yanya General Hospital, our major challenge is light. Light has been a major challenge to us because for me as a medical lab scientist, when we are done with our work and to post our results, before we know the light is out, other facilities abroad, hospitals abroad, when we look at the pay that they give to their professionals, compared to what we earn in Nigeria, it's something else. The difference is it's crystal clear.
When you come into the practice, you find out that just patient care, a lot of things, we know how to do these things, we want to do these things, but facilities aren't there. We have to contribute money to take care of patients. A lot of times doctors pay out of pockets. And when you see patients dying from things that are very preventable, things that are, okay, just take this medication, do this procedure, and the patient will be fine, and patients end up dying. It's very demoralizing. I think it's a sort of vicious cycle, because the more people leave, the more work is on the doctor remaining. That strains the doctors left, and they are exhausted, they want to leave, and that keeps on. So it's just a vicious cycle.
Nurses and midwives have also thin in numbers, and the doctor-to-population ratio now hovers around 3.9 per 10,000, below the suggested minimum.
The situation is worse in northern states like Bauchi, Zamfara, and Kebbi, facing a crippling shortage with a single doctor responsible for over 43,000 patients. Lagos, with a population of nearly 30 million, has only about 7,000 doctors, requiring an additional 33,000 to meet healthcare demands. Patients also feel the brunt of the challenges facing healthcare services.
Since 3 days now, I've been no treatment, nothing. To discharge is a problem. We pay money to a lady here. It transfer that money to a different account. Up to now, I haven't get the drugs. Allow me to talk. I'm angry. Up to now, I haven't get the drugs. I'm living without drugs, without nothing.
If you don't enter inside now, you see everything for there now. They don't die. That's why I beg. Help me beg government now.
Recently, Abuja resident doctors commenced a 7-day warning strike due to poor remuneration without a response from the government.
Each time we go to meet them, they keep telling us the same story. It's not in the budget. Wait for the supplementary budget. For the past 5 years, we've been waiting. We've changed ministers, we've been waiting.
This led to an indefinite strike. Government hospitals in Asokoro and Maitama were locked down, while the Gariki Hospital saw queues of over 300 patients a day.
Industrial disarmament appears to be the only language the government understands to resolve issues.
Experts warn that if the current pace of emigration continues, Nigeria may need at least 20 years to train over 400,000 health workers required to bridge that gap.
We can replicate the same model with healthcare. It's a very simple, pragmatic step, but until we see healthcare as a value contributor and not just as a social enterprise handout to individuals, we will never make that transition.
Imagine a healthcare system without doctors, without nurses, without the number one people who ensure that lives are properly catered to. What would that leave Nigeria? The federal government needs to act and act immediately. Olije Wapera, Arise News.
Well, joining us on the show to discuss the issues plaguing the health sector is Dr. Charles Ugwuanyi, former chairman, Nigerian Medical Association, NMA FCT chapter. Good morning, Dr. Ugwuanyi, and thank you so much for joining us today on the morning show.
Morning. Good morning. I'm happy to be here. Good morning, Ruben.
Good morning, Doctor.
Morning.
Well, very quickly, this issue of doctors succumbing to brain drain, resident doctors going on strike, jointed workers union, laying down their tools in Abuja. It's very familiar, and it's perennial. What do you think the problem is? And the ones that go abroad, what is it that is wrong with our system that we cannot keep our doctors here in a country where we really need doctors? We even need psychiatrists. It's even worse with psychiatrists. Most of our psychiatrists are now in politics.
Yes, thank you, Ruben. As you are aware, migration is as old as history of man. It has a very robust biblical background also. So it's the fundamental right of any human being, including doctors and other workers in the health profession, to migrate. So the issue really is to look at what are those factors, like you asked, that are responsible for this migration. And it's difficult, it's not very difficult to find the answers, especially if you look at already existing and familiar situations. There's a theory called the Ravenstein's theory, which you are very much familiar. It's a theory that defines, that makes the understanding of human migration very simple. So if we look at the essential elements and ingredients in Ravenstein's theory, you will see that there are pull factors that are pulling people out from one geographical locate to another geographical locate. And there are also push factors that are responsible for encouraging migrants from point A to point B. Situating this situation to the peculiarities that we find in the medical industry today, you find out that the Nigerian doctor is faced with a lot of push factors at the local level, and they have quite some attractive pull factors to those climes where they migrate to. Let us look at the push factors that are pushing these doctors out of Nigeria. The core problem here has to borders on the socioeconomic situation in the country, and also the security challenges. If you look at the socioeconomic factors, the main thing is it even goes beyond the amount of money that they earn. It also borders on the work environment. Work environment has to do with job satisfaction. What is the very basic reason why someone decides to be a doctor? It is not for you to become a rich man. There's no doctor who has ab initio, had an ambition to become a very rich man. If you want to be a very rich man, we're told in medical school is that you should go and do business or perhaps politics. It is a passion to make someone well that keeps us to continue to perform our duties as doctors. And now, you don't have an enabled environment, or the environment where you operate is decaying by the day. And also, if you do not have the essential ingredients that will make you to achieve results, you cannot send a man to go and catch a lion with bare hands. That is exactly what obtains in most of our institutions. Now, it is also important for us to understand that whereas these push factors are existing and people are migrating, like the Honorable Minister who has made so much effort, he made it very clear in that speech that in the last 5 to 7 years, up to 17,000 doctors have left the country. And I can tell you that that figure is very modest. In the actual sense, it may be up to 20,000. And now let's go down some basic statistics. If you look at the Nigerian Medical and Dental Council registry, the information is very clear there. You have up to 55,000 doctors that renew their practicing licenses every year, including those who are in diaspora. But then, how many are we remaining in the country today? I can tell you it's less than 40,000. What has happened, it is this migration which we are talking about. So, the government is doing so much to cushion the effects of this migration. As you are aware, the government has launched programs. The Nigerian University Commission have given accreditation to increase number of medical schools. Now we have up to 62 medical schools that produce doctors. So they want to increase the carrying capacity of those schools from the current 4,000 to 5,000 also to, double it or triple it in the current years. But I tell you something, there's something that you call Pipe C principle. Now, the drainage from the pool of doctors from Pipe C is so high that all the efforts that the government is making to reduce the effect of this migration is not being felt. Therefore, the numbers are really threatened. If it is only Pipe A and Pipe B, Pipe A puts doctors in the pool. Pipe B will be doctors that will retire or die or something, or that go into administration. They are not actively involved in patient care. But now you have an additional Pipe C, whose diameter is getting wider, and there's so much leakage is there.
Okay.
If you are losing 20,000 doctors within the space of 5 years, it's a big problem.
Okay. All right, thank you so much. This is a big problem on our hands, and it is, one that must take on critical attention and immediate response. Now, the NAD, the Association of Resident Doctors, have consistently gone on strike. Only recently they suspended a strike action based on some of these issues you've identified, on palatable working conditions. Now, how can we, or what can the Tinubu administration do differently from previous administrations? Because what has been said is that trust has been broken because promises are made they're not fulfilled. What can this administration do differently in the interim? And then is there any opportunity to have a reverse migration whereby those who have traveled abroad based on better working conditions, can we consider coming back home because we need an immediate solution? It's a crisis on our hands before we even begin to talk about training new doctors, getting new doctors into the systems. Our specialists are missing.
Yes, the Tinubu's administration, the current government in power, they are doing so much. It's just that the problems are equally enormous. For instance, the Honorable Minister of Health and Social Welfare, Professor Patti, launched in our ministry, a program that is called National Health Reforms Renewal Investment Initiative. This program has identified 4 thematic areas, very key. It is a product of high order thinking. And the key element there is governance in the health industry. Governance has to do with accountability. With good governance, funding, accountability, the aim is to make our systems function. If the systems function, how would the systems function? Is to make sure that the infrastructure is okay, the funds the patronage funds that are being released are very well utilized, and infrastructure is maintained, improved, and then the human capital that will run this infrastructure, they are there. Then equipment are obtained and maintained in all our institutions. As a matter of fact, another component of this four thematic area is focusing on is to revive as many as possible the primary health centers that cut across our different tiers of government, both at the state and local government level, using funds that you could grab from everywhere, including the 1% consolidated, which is expected to come in the basic healthcare, provide the basic care, cater for the basic healthcare provision fund. Now, in that program, it marked out about 17,000 primary health centers that will be equipped with infrastructure, enabled environment, necessary equipment that will make 70% of Nigerians are in those rural areas. They are not in Abuja, they are not in Lagos. And those are the people that need this. Now, if you provide that enabled environment at all levels, there is not every doctor that wants to go away. When you go away, you get disconnected from your family. And you're leaving your aged mothers, parents. So very few people, there are a lot of Nigerians who are Nigerian doctors going out who wants to stay back, and they just need that very minimal, safe working environment. Right? Okay. So the government is doing a lot already, but they can do more.
Dr. Charles Ugwuanyi, I mean, thank you so much, and good to see you. Happy New Year to you. Where do I start from? Okay, two things. All of these things you said, yes, these are the problems, but at the same time, funding is also a problem. I think it was the Minister of Health that was saying the other day that it was just, I think a year before, he was saying he had just only gotten about less than 20% of his capital infrastructure cost to be able to run and build new hospitals and things like that and other things they needed in the sector. So funding is one of them. The first question is, how do we give funding? Do we go through NGO partners and all of that? Because obviously government cannot fund it to a large extent. And that's why you're seeing the proliferation of many private people in the sector. I don't know how much they're being regulated, and that's why you're seeing a lot of problems. Secondly, there had been a plan on ground by Olukoye Ransom Kuti, Fela's older brother, Professor Ransom Kuti, when he was around, where he talked about the fact that your GP must be in a certain radius to you. The cost implication of that plan then was what, billions, but I don't know what the cost implication is now, at least so that you can get the primary healthcare system working and you have a GP close to you. Going back to that plan, how much will it cost us to be able to implement today that almost everybody has a doctor in a close radius to them? Let's put a cost to it, and let's look at funding models. Because government obviously can't fund it, and let's not say government revenue, because it's inadequate. We can't fund it. Let's be realistic with ourselves. How can we fund it?
Okay, thank you very much, Rufai. Let's first of all look at the real situation with funding the health system in the country and compare it with what obtains elsewhere. The annual health budget for Nigeria got to its peak 2025 when 1.6 trillion for the first time was allocated to the health industry. Yes, but then in the current foreign exchange rate, it is probably not as much as it was a few years back because of forex differentials. Now you compare that with the health budget of America, where these are doctors are going, or UK, where they are all migrating to. America is in 2025 is $5.6 trillion. United Kingdom budget for 2025 in the health sector is about 375 billion GBP pounds. So what the whole health ministry gets in Nigeria is not even anywhere compared to what one state in the United States get. So, and then the other sources of funding will include donor agencies. As you are aware, recently the Trump administration has removed some support they are giving to the Nigerian health industry. For one reason or the other, that has also worsened the situation. and other funds that come from here and philanthropists. So the fund is so little compared to the size of the problem. Sir, it will interest you to note that since 2001, they have AU declaration in Abuja here.
Okay, doctor.
That the fund that should be allocated to the health industry should be 15% of the annual budget. We have never met that. So funding is a problem there.
Okay, doctor.
So now, how can we now improve access to health? I'm trying to answer the second arm of the question.
Briefly, Dr. Ugwuanyi.
Yes, please.
Briefly, very briefly, because we seem to have run out of time. Go ahead, but make it very brief.
Okay, so what are the options left for us? Fine, we are practicing to improve access to health, decent health care. Currently, we are doing national health insurance scheme, which has helped quite a few people, but it has not penetrated. The penetrance to the rural areas is very low. Therefore, we must begin to think towards some form of community health insurance scheme that will improve access to the people that really need them. And then encourage more philanthropies, encourage private hospitals through quite a few government-sponsored incentives to encourage private sectors to engage.
Okay, yes. Doctor, thank you for bringing up the issue of insurance, because most Nigerians, they take care of their health out of pockets. And these pockets are dangerously empty these days. Maybe that's the bigger thing that government needs to address. Yes. Thank you very much indeed.